next topic I want to talk about for a minute is childcare. We said yesterday that we'd be providing more guidance today on childcare. We know that if we're going to have a potential crunch in the weeks ahead to provide medical services for people that may become critically ill in numbers that stretch our capacity, if we're going to be doing that, we've got to make sure that childcare is one of the essential pieces of infrastructure we need to be able to do that. And we've talked about the numbers before: 1,800 providers in our state, 44,000 students in that K through pre-K age group that utilize those systems today. We also have students that are below the age of 12 that are in our K-12 system. That would be people in kindergarten through approximately 5th or 6th grade. When you throw those things in, we have 132,000 of the citizens in North Dakota are under the age of 12, and that's a wonderful, wonderful thing. But 71% of the kids that are age 0 to 5 have all their parents in the workforce, and the labor force participation rises to 78% of kids that are in that 6 to 12 age group. So we know that there's been a big impact on child care with people suddenly finding themselves out of work because of the decline in oil prices. That was the thing that was hitting us in the last couple of weeks. So as we were having unemployment increases there, people are at home, they may be pulling their kids out of child care. So we've had reports of some child care providers who've seen a drop in their census count. That hurts their economics and creates challenges for them. And again, the child care sector in North Dakota is essentially a private sector solution. On the flip side, we know with the schools closing, then some of our child care centers have been reporting, hey, we've got a bunch of parents that, normally in the summer we would take kids that would be elementary school age during the summer, but we don't take them during the school year because they're in school. And now parents are saying, hey, can we drop off our kids that are in 1st through 5th grade? So others are seeing increase in pressure in terms of more capacity. The healthcare providers have all been calling us and saying, hey, we're concerned about child care for our workers. Should we be working to try to set up, temporary solutions? We would like to not set up temporary solutions. Child care is a federally regulated activity. To work in a child care center, you've got to be gone through a federal background check, which includes fingerprinting. You've got to go through licensing, which we administer here at the state. We care utmost about the safety of our children, and so we have no plans on relaxing the requirements to either work at or become licensed to do a child care. That's why we don't want to create a bunch of pop-up or alternative systems. We want to support those child care organizations, many of which are small businesses. We want to support them as they get through this. About 10% of those 1,800 have already closed. Many more have limited their service so far. What we're announcing today is a rapid planning process. It started over the weekend. We've identified 3 objectives from this planning that we're doing. One is provide child care for essential worker households. Number 2 is protect the health, children, families of child care workers. And then 3 is importantly, we want to sustain the child care sector as an industry that's essential to every business in our economy. If you think about it as sort of $1 million a day business in aggregate, it's about a $365 million aggregate business in the state of North Dakota that is again, severely challenged right now. So how are we going to do that? The planning process that we're going to look at is going to look at a couple of things. To improve and protect the health of the children and the people that work there, we're going to be putting together some modified operating practices. Those modified operating practices may include things like changing the ratio of the number of child care workers to the children. And that would have, if you're going to have increased distancing among kids or have them spread between more physical rooms to create that distancing, you're going to need more workers. Most organizations at a time when they're having a decline in their census count would be laying off child care workers. We're going to be likely heading towards a set of rules which will require them to have more workers. And so if we do that, then we believe that there may be a role and responsibility to consider financial support